No, they may not know.
Okay, diet, it really is a big thing in recovery. Making sure you get your antioxidants in, your anti-inflammatories, because it's an inflammatory process that's going on in the brain and throughout the body. Amino acids, the right foods to eat, with the right supplements. You can take ginkgo biloba. If you could check with your doctor first, it helps with memory a lot. It's a lot of foods like walnuts and blueberries and red meat. Get your B12 in. Your vegetables, such as broccoli and cauliflower. All that is terrific. And turmeric. I can't say enough good things about turmeric for all that it does. It's neuroprotective, and it's an antioxidant, anti-inflammatory. It helps with pain. It helps with swelling because you have headaches associated with this injury, and when things change in the body chemically because of it, hormonally, you can end up with joint pain if it goes into an inflammatory process of an autoimmune disease.
Right, and so that's one of the things I teach in my healthy eating classes. Your diet, most of the standard American diet, which is sad, is inflammatory.
Right.
It's processed food, lots of sugar, even wheat flour is inflammatory. People don't understand that even animal products are inflammatory.
Yeah.
So eating a lot of vegetables and the anti-inflammatory, nutrient-dense food is so important.
Yes. And to drink lots of water.
Yes,
absolutely. Your body needs lots of water normally, especially with a brain injury. You need at least your 8 glasses of water a day. Just flush it through, bring it with you. If you have memory issues and you forget to drink, just carry a water bottle around with you from room to room, wherever you go, so you always have it handy.
Yes, at least half of your body weight in ounces of water per day minimum. So if you weigh 100 pounds, you should be drinking at least 50 ounces of water per day. See my friend Drew at Water Cure USA. He will come and test your water for free, actually, because you don't want to be drinking water with chemicals in it either, so you want to have RO system or something like that. What else do people need to know?
Therapies. There are therapies that help. Speech therapy, if you run into speech difficulties, not everybody does. It depends on where the impact is. I myself would run into that because I would slow down and my speech would slow, and I would have to learn to speak what I wanted to say. It was hard for me to convey, to have a conversation. So it's a good idea to have a pen and paper, a notebook handy, because if you can't speak it, you could write it. But because everything is slow, your penmanship isn't going to be that great. It's going to look like you reverted back to a childhood age where you could fill up a whole piece of paper with 1 or 2 words, just getting it out. Because sometimes when you're trying to talk, you're stuttering, you know what you want to say, the word's somewhere up there in your brain, you're trying to grab it, to get it out, to pronunciate it correctly, to say it, and it's hard for the listener because a lot of times they become uncomfortable, they don't know what you're trying to say. So speech therapy can help with that. They can help with memory issues. Chiropractic care is great because when you have an injury, even with the head, you can most likely be out of alignment within your neck, along your spinal column, and it'll help with headaches a lot of times because the nerves run up along the side of the spinal column up to your brain. And some of the headaches that it helped me with was burning headaches. I would get a variety of different headaches, but one of them was burning sensations. But after going to a chiropractor, it alleviated that. So
there's so much good with chiropractic care. And I just want to say, your husband John's sitting here, and I know having a good support system, and thank God he knows the Lord of Lords too, is so important, right?
Yes.
That's, praise God that you have that.
Yes.
And what else do people need to know in terms of, of course, exercise?
Exercise, yes.
So what, you couldn't exercise, I'm sure, right off the bat.
Right, no, not right off the bat, but even walking, it's great if you can have somebody walk with you, because if your balance is off, if you tip, and just start on a flat, solid, hard surface to begin with, because anything busy on the ground, whether it's flooring, grass, leaves on the ground, stones, gravel, any of that, even snow especially, because there's so much, you're not sure where to place your footing. You're almost you're very cautious of how you place your next foot because you don't know how far your foot's going to go down, the way your brain is trying to perceive your steps, and be very careful around steps or
The curb.
inclines, the curbs, everything. And if you tip, so you could start with walking. Crawling is actually great because it engages your brain and starts making those new connections. And it sounds silly, with an adult trying to learn to crawl again, but it's so beneficial for growth of infants, for their growth later in life, and with cognitive benefits as well. So it really engages you which arm and which leg to move next. So there's a series of exercises. It's good to stay physically active because it helps with the healing process as well. Mm-hmm.
And there's so much good in your book here. Support groups, prayer, meditation, sight and light intolerance, sound and noise intolerance, the therapies, nutritional supplements, physical needs, all of that. So where can people get your book?
They can get that at lulu.com, and if they do purchase on lulu.com, I do make a donation to Hope's House Kenya. It helps. It's helping to build an orphanage in Kenya, and also Beacon Christian Bookstore at 2480 Military Road, Niagara Falls, New York, and Amazon as well.
So traumatic brain injury, TBI, post-concussion syndrome, PCS. C. Ray Johnson is her name. Do's and Don'ts of Personal Journey. There's 2 books. Carolyn, I'm just so grateful that you're okay. Praise God for that. And you're pretty clear, today. I know that, you still have once in a while some trouble, but praise God that you're here with us. And, I really appreciate you joining us today.
Thank you. The Lord says, my presence shall go with you and I will give you rest. And that is something to really help somebody going through this. When you get overwhelmed and you're ready to just, you just can't handle it, to know that the Lord is with you, you can rest in Him at that moment.
I love that. And praying about everything. Again, I say to you, if 2 of you agree on earth concerning anything they ask, it will be done for them by my Father in heaven, in Matthew 18:19. The principle here is when 2 agree and pray together, there is power, it cements in what is agreed upon and brings fruition. And we can't do all of these trials alone, right?
No,
Philippians 4:13, we can do all things through Christ.
Yes.
Who strengthens us, right?
Yes, you can even write books after a brain injury.
That's amazing.
Right there shows God's hand. Right? His hand is on everybody.
Praise God, praise God. Thank you, Carolyn Johnson,
Thank you
for
having
joining
me.
us. And all right, everybody. So listen, hopefully you'll have a great week. I know that I'll see many of you today at 1 o'clock, God willing, at the Lancaster Catalyst Fitness. That is on French Road. It's the one on French, because there's 2 out there. Make sure you go to the one on French Road at 1 o'clock. It's open to the public. And then at 2 o'clock, I'll be giving a free seminar, Let Food Be Thy Medicine and Medicine Be Thy Food. I hope I see you all there. Have a wonderful week, everyone, and God bless.
God bless.